tuck nightmares, the questions to ask before you agree to any procedure. Fox 5 Morning News at 9 starts right now.
Serving all of San Diego, this is your Fox 5 News.
It is a dangerous new world of cosmetic surgery, one where many doctors are performing procedures they do not necessarily have the medical training to do. Board-certified plastic surgeon Dr. Marin of Marin Aesthetics is here to break down the crucial questions to ask your doctor to prevent a nip-tuck nightmare. Good morning to you.
Good morning.
All right, so why are we seeing this spike in surgeons or doctors or whomever performing these procedures that they're not necessarily trained to do?
Well, I think the reimbursement for a lot of normal surgeries or procedures has gone down considerably, and doctors are looking, unfortunately, and this bad economy affects everyone, looking at alternative ways that they can kind of supplement their income, meet their bottom line, and so people are looking into cosmetic surgery as perhaps an easy way to kind of make ends meet in some of these difficult times. So we've seen it recently because the economy has not been so great.
Is it legal for them to do that?
It actually is. Anyone in the United States that has a medical license can perform almost any procedure. Cosmetic surgery is distinct because a lot of it's done in outpatient surgery facilities or in someone's office, and so the restrictions are much less. And so that puts you know, doctors in a situation where they could extend their scope of practice without having any real legal complications associated with that. So it's a danger for patients.
Yeah, I was going to say, I would imagine there are lots of risks involved in having somebody do that that hasn't been...
And a lot of times you see doctors, and they may be great doctors, but it doesn't mean that they're a great doctor in a whole different specialty. And one of the issues that come along with that is they're not properly trained, and there are very distinct ways to be licensed or go through this in a normal training process. And some of these, you know, with what we go through in plastic surgery, we have 7 years of training, whereas some of these doctors will end up with a weekend course and then take that out to their patients, and it can be very dangerous in the wrong hands.
Do you have any stories or any nightmare stories that you've heard of somebody getting a procedure done by somebody that just wasn't legit?
Just recently, it's come out in the news. There's been several. They've had OBGYNs that are doing hysterectomy, and at the same time, they say, you know what, we're here, let's do a tummy tuck. Yeah. Some of the problems when you combine these procedures in the wrong patients, you can end up with awful open wounds and the separation of the incisions, and this could leave you with a open wound for months. And so you can run into these problems. Even there was another internal medicine doctor recently that was actually convicted of manslaughter for not properly knowing what to do in a complicated in a post-operative issue. He wasn't able to treat, and so it's a problem for patients, and it's really important for them to do their research.
Okay, we have a number of things that you really should know before you get a procedure done. We're going to go through them really quickly. The first one is, who can perform cosmetic surgery in the U.S.?
And in the United States, almost anyone with a medical license. So it's very important when you find a physician to make sure that actually it is a doctor that's board certified in the procedure that you're looking to have. So there's 4 states, California, Texas, Louisiana, and Florida, the only ones that require you to actually say what kind of specialty that you're certified in. So the rest of them, you're kind of on your own and doing your own research.
Speaking of, I know it's a kind of a complicated answer, but what exactly does board certified mean?
Board certification is an independent organization that helps patients. It's not designed to help doctors, but it's kind of a consumer reports for physicians in the sense that they make sure that all of the doctors that are board certified in the specific specialties are have accomplished all of the proper training, have maintenance of certification. They continue to learn. They continue 50 years of continued medical education every year. And so it's a organization for patients so that they can understand who their doctor is. So that's why you want to find someone not only board certified in the specialty that you're undergoing or that procedure.
And the next thing we want to get to, are there different types of boards?
Multiple. There's boards in orthopedic surgery, neurosurgery, pediatrics, but there's also one other board that's kind of come up lately. It's called the Board of Cosmetic Surgery, and this is the one thing that's confusing to patients. It's a board that's not recognized by the American Board of Medical Specialties, but it's got a very clever name, and it sounds like you'd want to go to someone in cosmetic surgery if that's what you're having, whereas that's a board that has become more of an application process, not something that's been 7 years of training and all of the prerequisites that are required. So it's very important to make the distinguish American Board of Plastic Surgery or the American Board of Cosmetic Surgery surgery. They're two very different things.
How do you know if your surgeon is certified? Is there like a website that you can go to and
You
check?
can go to the American Board of Medical Specialties. They'll have links there, and most surgeons in California should be required to say what specialty they're certified in, and it's very distinct. And sometimes you have to do a little research to find that. You got to dig deeper into some of those pages.
Dr. Myron, thank you for being here. We
My
really
pleasure. Thanks for having me.
appreciate it. And to get in touch with Dr. Marin at Marin Aesthetics in Del Mar, head to our website, fox5sandiego.com, and click on that Scene On tab. Raul, back over to you.